Surgeons, doctors have read it. What's the dumbest thing patients have lied about? Do you smoke cigarettes? No, I quit. When did you quit? This morning. Quitting's easy. I've done it 1,000 times. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke. But they'll tell me they don't right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprise Pikachu face. I'm a dentist, and people try to tell me they don't smoke. When my dad stopped smoking, his dentist gave him a gift certificate for a nice restaurant. Said it made his job so much easier. They were friends too. Honestly, the dumbest lies are the one people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you, and if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital. So be honest, I truly don't care how much you drink use. I just don't want you to get worse for something we can plan for and prevent. Had a patient tell me they don't drink because they were a recovering alcoholic. A little further prodding and turns out the patient eats bowls of rum-soaked raisins because it's eating and not drinking, so it doesn't count. Would literally empty a bottle of rum into a bowl full of raisins, let it soak for a bit, and snack on those throughout the day, all day, every day. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. If I had a bullet in my ankle, I'd probably wreck on my bike also. LOL. I fell down onto my couch and a cucumber was sticking up between the cushions. It went right in. 1. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? 2. How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. 3. Me, have you had anything to eat or drink today prior to your surgery? Patient, no, with a half-eaten candy bar in front of them. Me, are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient, then yes, I have. I had half that candy bar. 4. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, They did that last time. I didn't like it. My favorite assailant was some guy. I was just walking down the street when some guy stabbed me, or some guy shot me when I was getting gas. Be careful, everyone. Some guy is out there, he's dangerous, and will fuck your shit up. Do you have any medical problems? No. So no diabetes? No diabetes. What medications are you taking? Metformin. For my diabetes. I facepalm every time. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, Sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness brings to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Their age. Had a woman say she is 30 when she clearly didn't look it. Oh well, I move on to other questions. Look at her files and lab reports have her real age on them. 41. Like why though? What difference does it make lying to healthcare staff? This is health related, not your Tinder profile. Nobody gon' see this and go I ain't dating an old lady. By the way, she was married with children. I had a guy insist that someone else put cocaine and heroin in his urine, even after I tried to move on with the conversation. Had someone say that their roommate used a spoon when cooking meth, and then he ate cereal with that spoon later, and that's why his piss popped hot for amphetamines. We have a favorite story about a colleague who failed a random drug test. Turns out, he was at a party where other people were doing drugs, not him, but he put his sandwich down on a table at one point. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts, from light bulbs to hairbrushes to a golf shoe. And at first it's hilarious. Then after a year or so it's not funny because you've seen way too many distended buttholes. Then after a decade or so it starts to get funny again because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife and he has a golf shoe up his ass, and he told his wife that he and the boys were golfing and he slipped in the locker room and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Wait, don't golf shoes have spikes? Yes. Nurse here had a patient who wasn't to eat anything. Swear to me she didn't eat any of the McDonald's her boyfriend brought in. She proceeded to vomit French fries and milkshake up 20 minutes later. She stuck to her story and still swore she didn't eat anything even as I was mopping her barf up off the floor. Did cocaine the night before elective surgery, didn't disclose at pre-op. Cardiac arrest. Beta blockers and cocaine don't mix well. First baby, never pregnant before. New obstetrics appointment. We collect everything and do exam. I put a speculum in and I see her cervix. After her partner left the room, I ask her again, and she says she doesn't want her new partner know that she's a single mom. Not dumb, but just very obvious on an exam that she has definitely given birth before. I left a note on her chart to not mention prior pregnancy in front of her new partner. How did she think that was going to work? I don't know. I am there to protect her privacy and provide health care. This was at a safety net clinic during my residency. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the emergency room with a towel over his groin, covered in blood. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses to trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to help save him, but it cost a hell of a lot more than $200 for emergency penis surgery. I'm just a med student, but a doctor shared this with us. She's a gynecologist, and this woman came to her complaining about how she hasn't gotten her periods in few months, and well, she was showing menopausal symptoms, and in fact she looked almost 50, but she kept saying she's only 30, and she can have menopause. It has a funny ending, when the doctor asked if the woman had a kid and she said yes, he's 27 yo. I don't know why people lie about their age, but this was a funny story for the whole class. I work in ophthalmology. I see patients nearly every week that are faking vision loss. Most often, it's to try to get disability. Sometimes it's just attention-seeking or extreme stress anxiety. In rare cases, patients truly believe they cannot see or have convinced themselves they cannot see, when all exam findings and testing are normal. It's called non-organic vision loss. Adherence to medical treatment when I have literally pulled their pharmacy records and know they haven't picked up their medications in over a year. Anything, to be honest. I honestly don't care what you do or don't do. Usually, if I'm asking, it's because it matters for your health care, and if you lie about it, all you're doing is putting yourself in danger. As a more real example, I've had a post-transition transgender patient lie about the sex they were born with. I understand it's hard to deal with a lot of the medical community that can be judgmental, but this patient ended up having prostate cancer. Only found out after we scanned them. Another one lied about having prior back surgery before I was about to send them for an MRI. Did a physical exam and saw the scar. Asked again, and they just said they didn't feel it was important, and didn't want me to assume it was related to previous surgery. They were there for back and abdominal pain. Do you have a similar story? Leave a comment, and subscribe to the channel if you want to see more videos like this one.